Greetings. I haven't been here for 6 years it's been since I last spoke here. It's wonderful to be back in Seattle. Couple of things. Rainier exists. Today was the first time I actually saw it on the ground. I've seen it from the air, but I've been to Seattle a few times, and I lovingly teased all of you. I don't believe you. It's not really there, but it is there, and it's beautiful. And thank you so much to Sherry for opening her home for me to stay in. It's been a real treat, and it's always good to see friends and friendly faces again. Nancy, the last time we were here, I stayed with Nancy, and it was so nice. Always good to see John Nichols. It's wonderful to be. And I also now serve as the executive director of Progressive Democrats of America, so I'm very proud of that. And I don't worry about it being a nonpartisan meeting. I would like to see Bernie be the President of the United States. I don't know what will happen with that. I think one thing I do want to share with you is I was at a Bernie rally in Denver last Saturday evening. He and Hillary were both slated to speak at a Democratic Party dinner that evening at the Sheraton Hotel, but Hillary held two smaller, more well-controlled events in Colorado during the lead up to that dinner. Bernie decided to do a convention center, Denver Convention Center rally on Saturday evening, and 20,000 people showed up. It was pretty impressive. And the most impressive thing to me, there were a couple of things that really stood out for me. I wrote a little bit about this earlier this week on Common Dreams, but a couple of things stood out to me. The diversity of the crowd was pretty impressive. Early on, I was seeing a lot of people, if Congressman McDermott was still here, I'd say, hey, gray hair. I don't have too much of that yet. But the crowd was very diverse, very different than it had been early on in Bernie's campaign. We had a lot of young people, a lot of very diverse cultural backgrounds in the room. Lots of kids were there with their parents, which was wonderful. It created a really powerful energy in that room. The other thing that was fascinating to watch, just from the perspective of having been a part of political activity for most of my adult life, and for many of us who came of age in politics in the 60s, we have been active in political life, but we haven't done so well in some of the things we've done. But Bernie's message, people repeating that from the crowd to him, from the more humorous moments of when he'd say huge and the crowd would go huge, and that was wonderful to hear. But what was really pretty moving is when he quoted Abraham Lincoln from the Gettysburg Address, and when he said, of the people, by the people, and for the people, and the crowd owned that. That was pretty powerful. It wasn't in kind of a cheering, kind of raucous way. It was in a very meaningful way. And I haven't heard that in my adult political life before. So whatever happens going forward in this political season, and I don't think any of us can really predict that with great accuracy. Maybe John will be able to do so better than I can. But, I don't think people would have predicted much, as Bernie says now. 9 months ago, would we all have predicted this? What's going on now? No. And talking with that wonderful group of students that I was so pleased to be with yesterday, and asking them, what is it about Bernie Sanders' campaign that reaches out to you? I mean, arguably, here's the oldest person in the race running who's appealing to the youngest people in the voting public. And the resounding message to me has been, whether it's the group yesterday or other places, has been honesty. Integrity, the issue of being told the straight truth about things, and that matters. It matters a lot what we say to young people. They don't suffer fools a lot, I don't think. This generation is smart, a lot smarter than people give them credit for, a lot smarter than I was at their age. The world comes at them fast and furious through every imaginable method possible. I'm on Twitter and Facebook, and they're done with Facebook and they're on to other things. They do a little bit of Twitter, but they're on to other stuff that I don't even know what all of that stuff is. But what they really care about, whether it's here in Washington State, where, by the way, University of Washington students are doing a March for Bernie on February 27th. I saw them handing out little slips of paper yesterday that were very much student slips of paper. So I hope they'll support the work that they're doing. It matters so very much. So thank you, students, for being a part of that yesterday. It meant a lot to me to hear that, and it means a lot that you're engaged in this election. It is changing the face of this election. It truly is. And I often say, I said this to a few people in the crowd in Denver on Saturday night too, was if there's nothing else my generation gives you, nothing else, thank God we're giving you Bernie Sanders at this point. Right? Because we've kind of blown it. My generation, we had all these hopes, and dreams. We were the make love, not war generation. The people who came out of the hippie culture of the 60s and the beatniks before that. And, we were going to change the world. We were going to make it a different place and put an end to war and put an end to poverty and be something more than what had happened. And then we got busy. We got busy in our lives and our families and raising kids and trying to survive through stagflation. How many of you remember that word, stagflation? And all the things, and then the Reagan years, oh God, the dark Reagan years in the 1980s, and and then coming through that and getting the first Bush president. And I hear Jeb Bush dropped out just a little while ago out of the race. Jeb's out. So, we did that, but only as we come to this point, at least for me, coming to this point in my life, I've always stayed a little bit active in politics, but it's been pretty anemic in terms of our ability to get things done in this world. So I don't want to leave you a mess. I want to leave you something better, especially where healthcare is concerned for me. Many of you have heard my story. Lots of you have seen me on a big screen in a pink flannel nightgown, if you saw Sicko, so you don't have to hear too much more about that. How many have seen Sicko? Everybody? Pretty much? That's good. I'll be real fast and give you the 2-minute elevator speech on how we ended up there. My husband Larry and I have been married for 40 years. We always had health insurance, always made it a priority to have health insurance, did what most American families do. We'd take a look at which employer was offering the better plan for our family and then make a decision to go with that plan. But when my husband had serious coronary artery disease, and actually he's had peripheral artery disease, he has carotids done, he's had iliac artery bypass, we're replacing his arteries apparently one at a time. He's a tall, slender, athletic guy, so it's not, this is a genetic thing for him, very much so. But then I was diagnosed with cancer, and it was our insurance benefits and our whatever we had in savings in our home was no match for the healthcare system, and how quickly the bills were ringing up and how quickly the dunning calls came from hospitals and other providers who wanted to collect their money that were deductibles and co-pays and out-of-pocket expenses. And I always tell people the last straw for me was I was sitting in my office at the newspaper where I worked. I was the editor of a small-town newspaper in South Dakota, the Black Hills Pioneer, the longest publishing newspaper in western South Dakota. The Black Hills Pioneer published news of Wild Bill Hickok's death on August the 2nd of 1876. So I was very, very proud to be a part of that kind of journalistic history. Really, I truly was. And I was very proud of the fact at the time, Tom Daschle was the Senate Majority Leader at the time, and my newspaper, because we were in such a conservative part of the state, had never published anything about Tom Daschle. They only wrote about the Republicans. And when I became editor, said, we're not doing that anymore. We're going to write about everybody. But in any case, I was sitting at my desk one day, and somebody came and got me, and they said, Donna, there's a process server at the front desk for you. And I said, a process server? And so I got up and I went out, and I was being sued by a dermatologist. I had some of the cancer treatment I had left some pretty bad scarring from some radiation therapy. And of the $6,600 that treatment cost, $600 of it was my responsibility, that 10%. I had tried to work out monthly payments. This dermatologist didn't want it, so he was suing us for that for want of $600. We had to declare bankruptcy because there's only one way in this country to get out from under being sued like that, and that's to declare bankruptcy. And people say, $600, couldn't you borrow that from somebody? The reality is, by the time most families get to that point, they've already done that. They've borrowed from everybody in their family and their social network, their neighbors. It's humiliating to the point where it changes every personal relationship you've had. You know, people will hear your your voice on the phone, and their tone of voice will drop because they're afraid it's Donna and Larry calling to borrow money again. And sometimes it was. And we just had nowhere else to turn. So for want of that $600, we had sold everything we had, and so we went bankrupt. We became one of the many, many, many thousands of people who go bankrupt in this country every year as a result of medical debt. That has not stopped with the Affordable Care Act. I know people would like you to think otherwise. They'd like you to think that medical bankruptcy is a thing of the past. It's not. It's not, because think about the story I just told you. $600 did us in. Because it wasn't as if we wanted to go bankrupt. It wasn't as if that was the course we wanted to take. You know, I was raised like many of you were. You don't do that. Bankruptcy is for those people who are irresponsible, who take out too much credit, who get big screen TVs or take on cars or other debt that they shouldn't be taking on. I was raised that you pay your bills. You always pay your bills. And it was heartbreaking, and it was humiliating, and it made me have a gut-wrenching shame in my life that I had a hard time shaking, still have a hard time shaking it. And the only reason I talk about it as openly as I do is because it's still going on. The Affordable Care Act, the worst word in that entire thing is affordable. Because it's not. My monthly health insurance premium, just for me, is more than $700 a month. Just mine. And some of you have already heard this story today, or this weekend, so I'm going to go really quick through it. This past year has been a pretty awful one for me in terms of health. I tell people I don't know why I continue to have to provide the perfect storm of an example in our healthcare system for what's going wrong, but apparently I do. And last, I had been treated for anemia for about 2 years. Nobody had found out what was wrong, even though every PNHP doctor around me who knew I was getting transfusions and iron infusions and everything said, "Where are you bleeding? You're losing blood somewhere." And I'd say, finding it. On St. Patrick's Day last year, March the 17th, I was standing in the kitchen fixing lunch, and I felt kind of a whoosh, like something happened really badly. I started to pour sweat from everywhere on my body, and I couldn't speak. I thought I was going to go down. I thought, I wonder if this is what it feels like to die. I think I'm going to die. And so I just laid across the kitchen counter. My husband was only 20 feet away, and I couldn't say a word. I couldn't speak. And I finally, after a moment or two, I said, "Larry, I need help." And he came and got me and took me to the recliner and took my blood pressure, because he has a cuff as a heart patient. My blood pressure was 80/50. Not good. But the first thought in our minds wasn't to dial 911. At least it wasn't in mine. Guess why? The cost. I was afraid of two things: afraid the cost of the ambulance, and afraid they'd take me to a non-Kaiser facility. Those two things. I thought, oh my God, I can't do this. So anyway, Larry poured me in the car. We drove like crazy, which wasn't the smartest thing to do, down to the hospital. We get there. They admitted me, of course, because I had lost a tremendous amount of blood by that point. Had just had 2 units of blood the Saturday prior. Thank God, or I probably would have died. Anyway, so 6 days later, after they worked me up, can't find where the bleed is. They knew I'd had a gastric bleed, but didn't know where it was. Sent me home with an IV site that looked a little bit crabby, as the nurse put it. Little crabby. I got home, 101 temp when I got home. Tried to call the hospital back, and any patient in here knows the response you're going to get when you call the hospital back. Call your primary care provider. We're done. You're discharged, call your primary care provider. So I sent a picture to her, because Kaiser allows you to send pictures and send emails, so I did that. No response, no response. By the next morning, I had 103 temp, was really feeling very sick. Anyway, long story short, I ended up with MRSA. I was in the hospital, back in the hospital. It damn near killed me. Damn near killed me. I had docs in here will know the name of how you do this, but they took a vein from my wrist to my chest wall, had to come out. I had pulmonary embolisms like crazy. I mean, it was not good, not good. And then by the time I went home 9 days later from that, I had to be on vancomycin, pretty high pressure antibiotic for almost 6 weeks with in-home nursing care. Kaiser didn't want to provide wound care, which was interesting because then the surgeon got angry and said, oh, yes, you will. There were 10 drains in my arm. So in any case, I worried. The biggest thing I worried about, my family was there with me, but the biggest thing I worried about was not that I was going to die. It was that I wasn't working. I wasn't working. And I know John's going to talk a little bit about modern working life. I'm one of those people that has to pull together a number of sources to make an income. And if I'm not working, I'm not earning. And in the background is that $700 premium that's looming over me, plus all the bills that have to be paid. I just wanted to get the heck out of the hospital. I didn't care what was going to happen. I just knew I had to get back to work. I had a pulmonologist talking to me on one side and my husband holding the cell phone so I could do a conference call on the other. And I was begging some people who should know better, really, to be honest, some employers who should know better, to don't give up on me. Please don't give up on me. Please give me time to get well. That's what it's like in America in healthcare, under the Affordable Care Act. So we in Colorado have a different kind of plan going on right now in terms of, we still have direct access to the ballot in Colorado. Thank God, because our legislature, we had 2 legislators who were recalled because of their stance on gun control. The Republican right wing was very effective in targeting 2 of the most effective legislators we had on the Democratic side and throwing them out of office. That put a chilling effect on everything the Democrats do in the legislature. So when our chair of the health committee, Irene Aguilar is her name, came forward with a plan called Colorado Care in how to advance a universal health care program for Colorado, it was going nowhere in the legislature because those people were afraid they'd be targeted for recall as well. Nowhere in the legislature goes down. They're not going to move it. They're not going to take it out of committee. They're not going to do anything. So a number of people said, let's go see if we can get signatures and get this thing to the ballot and ask the voters of Colorado whether or not they would like to see a truly universal health care plan. So a very aggressive signature campaign. You have to get a certain number of signatures calculated on the basis of congressional districts and how many voters there are and all those kinds of things. So people knew they had to get about 100,000 signatures from registered voters in Colorado. That wasn't going so well. You get 6 months to do it. It wasn't going extreme. It was our second try at kind of a healthcare related ballot initiative. The first time we didn't get to the ballot. This time they fought and fought and fought. One person ended up literally putting a second mortgage on her home to hire paid signature gatherers at the last minute to gather enough signatures to get Colorado Care to the ballot. So it will be on the ballot on November 8th of 2016. And it's not a perfect, as PNHP will sometimes point out, it's not a pure and perfect single-payer plan. But to put it in perspective, it's a heck of a lot better than what we have right now with the Affordable Care Act. For me, the difference would be with a 3.3% in payroll tax and a 6.7% employer tax. For me, the difference would be taking my cost for insurance from $700 and some a month down to about $140. What a huge difference that makes for me. And for so many people in Colorado. We still have tens of thousands of people who have no coverage. We have families who work up in the communities of Aspen and Vail, where there's an incredible amount of money flying all over the place, but there are a lot of service personnel up in those communities. And they can't afford the insurance that's being offered because insurance, they're allowed to go ahead and do some rating for those areas. The other thing that's frustrating to so many of us under the Affordable Care Act, the age rating issue is huge. Now you're allowed to be 3%, you can charge up to 3 times as much for age rating, and Kaiser's so kind, they only do 2.8% as much for age rating. So we're hopeful in Colorado. We are not confident as yet. And there will be a call that will go out to other states, I'm very certain of this, early in the summer to ask people to come canvass, to come do some things to help. We'll get some people who can phone bank from other locations. We're gonna need help from other states, because whether or not we can get Colorado Care across the finish line to really win in Colorado, it would be a lot easier if Bernie Sanders was the presidential candidate, much easier. It'll be a tougher run if it's Hillary, but it'll be an even worse thing if the Republicans end up with a lot of energy going into the presidential election. It'll be very difficult. So a lot will depend on what that ticket looks like going forward. But we're very pleased it's on the ballot. We're very pleased that we have a chance to make some inroads on this. I don't know what will happen. I can't really predict. People ask me. There's a part of me that says there's no way in hell. There's just no way, because already the Chamber of Commerce has come out against it. A former governor, Bill Ritter, has come out against it. No shock there. Ritter laughed at me the last time I talked to him about single payer. Unfortunately, John Hickenlooper, the governor right now, made some negative comments in the past couple of weeks about Colorado Care after he had promised the state senator that he would stay neutral on this issue. So it's an uphill battle. But it's a battle. It's a battle. Thank God. I mean, this is the first time we're really seeing people all over the country. I'm also very lucky to be part of a group called One Payer States, which other people, PDA was instrumental in starting. If you don't know what One Payer States is, I see my 2-minute warning here. This is good. One Payer States is a group of people who came together in Wayne, Pennsylvania at a PDA regional meeting in 2010, and we decided that it would be good if state-based single-payer activists were talking to each other about what's going on in their states, sharing successes, things that were challenges, how we could move forward together. And that group has stayed together now for 6 years. That's pretty impressive. And we have monthly conference calls. We try to bring issues that are important to those states who are working together on single payer. And we don't know if this country will go state by state by state, or whether we'll eventually get, it's hard to imagine this Congress, isn't it, ever doing something on a national level? It's really hard to imagine. But we're not stopping. And the only way you'll stop me from fighting for single payer is if I'm dead, and so far the healthcare system has not been able to do that to me. I keep coming back. I keep coming back for more. So thank you so much, Seattle, for what you're doing, and for Washington State. You guys are awesome. We look a lot to our neighbors, our neighboring states that are close in the West, and we have to stand up with each other and for each other and make sure that healthcare becomes a human right for all of us. Thank you very much.